Hi there, my name is Abby Pierce. I'm the dietetic intern at this facility. Can you just go ahead and verify your first name, your last name, and your date of birth for me so I can make sure I'm talking to the right person?
Lizzie Pierce, June 11th, 1999.
Perfect. So you just underwent a major surgery a couple days ago. It's been a couple days now since your operation. So your doctor has just asked that I come in and perform a nutrition-focused physical exam on you. So basically what this means is for someone who's just underwent a surgery and they've been in the hospital for a couple of days, we want to check their muscle stores, their fat stores, and their micronutrients to see if there's any deficiencies there that would be evident physically that could indicate malnutrition. So we're just gonna, in this exam, I'll start by up at your head and we'll work all the way down to your toes, and I'm just gonna check things out and make sure that everything looks fine and functioning normally. So if it's okay with you, I'm gonna go ahead and get started. And if you feel uncomfortable during any point of this, or you have any pain or anything like that, just go ahead and stop me and we can talk more about that. So when I'm gonna start at your head with your hair. I'm just gonna assess your hair for any dry, dullness, flakiness of the scalp, anything abnormal that might come about that, any hair loss or thinning or anything like that. So I'm just gonna go ahead and look up here. Everything on your scalp looks fine. Everything along here looks fine. The appearance of your hair looks good. You have no dullness, dryness, thinness, anything like that that would be of concern. So everything up there looks perfect. So next we're gonna move into the cranial nerve portion of the physical exam. So I'm gonna go ahead and start by asking you to raise your eyebrows up nice and high. Perfect. And then puff your cheeks out. Perfect. And then I'm gonna just take this flashlight and look at your eyes closer. So if you can go ahead and just stare straight forward at me at my nose. Perfect. And then to my right ear. Perfect. And then my left ear. Perfect. And then I'm just gonna go ahead and have you follow my finger. Perfect. And I'm just looking into your eyes right now. You have no yellowness or darkness in the whites of your eyes, which look good, and everything in your eyes seem to be looking fine. So I'm just gonna go ahead and take my hand and put it here, and I want you to push your face against my hand in this direction. Perfect. And then again in this direction. Perfect. And then I'm gonna ask you to just stick your tongue out like that and move it side to side. Perfect. Now I'm just gonna go ahead and ask you to open your mouth again, stick your tongue out and say ah, ah. Perfect. And I'm just inspecting the inside of your mouth right now. Everything looks good. You have no white specks on your tongue, no darkness or patchiness, anything like that on the inside of your mouth, on the tongue. Your teeth look to be in perfect condition and your gums are nice and pink. There's no excess redness or puffiness or irritation of your gums. So that looks fine. And then I'm just looking now at the corners of your mouth and your lips to check for any colitis, which would be flakiness or dryness on the outer corners of your lips, which you don't have, so that's perfect. And your lips are a nice red color. You don't have any paleness or loss of color in your lips, which is great. So next I'm just gonna ask you if you can smile nice and big. And I'm just gonna feel along your jaw down here to make sure that this is all intact and good, which it is, nothing abnormal there. So that's gonna conclude the cranial portion of the exam. So everything looked good there. You passed that, nothing abnormal came from that. Your cranial nerves are fully functioning, which is great. So the next portion of the physical exam is gonna be your dysphagia screen. So this is just checking your swallowing function and making sure everything looks normal and is working properly there. So first I'm gonna ask if you can just give me a nice big cough. Perfect. Did you feel anything abnormal with that? Any complications?
No.
Okay, perfect. So the next part of this is I have this cup of water here, and I'm just gonna ask that you drink this continuously. Don't stop, just drink the whole thing until it's gone. And I'm just gonna have my hand placed right on your throat just to feel when you're swallowing. Okay, so go ahead. Okay. Perfect. Do you feel any fluid stuck in your throat or anything like that?
No.
All right. So I'm just gonna stand here for another minute or so and watch you and assess and listen for anything that might be abnormal, if you have any water that's regurgitated or any changes in your voice or anything like that. Okay?
Okay.
All right. So now that it's been 1 minute, how do you feel now? Anything abnormal going on in your throat?
No.
Perfect. So you've passed the dysphagia screen. It means that your swallowing functions are working properly and you have no risk for aspiration, which is perfect. So next we're going to go into, I'm going to reassess your head region and check for any muscle wasting or fat loss. So I'm going to go ahead and start by taking my 2 fingers and I'm just going to feel along your temporal region up here. Checking for any dentiness or sunkenness of your temple region, which could indicate muscle loss. Everything looks good up here. It's bouncing back perfectly, and you don't have any abnormal curving or denting of the temples, which is perfect. So now I'm just going to go ahead and ask you to look straight on at me. I'm going to check your under eye region, your orbital region, and check for any extreme sunkenness or depth in your eye region, any darkness or yellowing of the skin. Everything looks perfect there. So I'm going to go ahead and take my fingers again and just feel under your eyes, under your orbital regions, and palpate this area. Nothing abnormal is coming about this. Your skin's bouncing back nice and perfectly, which is what we would expect in someone, a healthy individual such as yourself. So next I'm just going to continue to take my fingers again. I'm going to go down here and feel along your cheek region, your buccal pads, fat pads, and check for any sunkenness or loss of muscle over there. Everything looks perfect. It's bouncing back just like it should. And then I'm just going to ask if you could tilt your head up a little bit. I'm just going to inspect your neck down here and check for any abnormal bulges or what we would call goiters, which could indicate iodine deficiency and the abnormal swelling of your neck. But everything looks fine there, so nothing is of concern. Doesn't seem like you have any muscle wasting or fat loss in your head area. So all of that looks perfect. So now I'm going to go ahead and move forward and I'm going to assess your clavicle here. So I'm just going to run my fingers along your clavicle region and assess for proper muscle stores and fat stores. So everything looks good here. There's no obvious protrusion of your clavicle bone. In someone who might be malnourished, your clavicle would be sticking out a lot from your skin and it would be very bony. But that's not an issue for you. Everything looks nice and healthy. So I'm gonna go ahead and move down and assess your shoulders and your acromion process and just feel for any squareness of your shoulders. But everything feels nice and round over here. You have adequate muscle stores, so nothing is of concern there. In someone who could be malnourished, your shoulders would be squared, very obviously, but that's not an issue for you. So I'm gonna go ahead now and assess your upper arm and tricep region. So I'm just gonna go ahead and hold your wrist up here for some support. And I'm gonna take my thumb and my forefinger. I'm just gonna run my fingers down here along your upper arm region and grasp onto some fat, making sure that it's not muscle. I'm pinching it here. You have a nice good fat store down in your tricep area. And someone who is malnourished, my fingers would almost be touching together, but that's not the case with you. So that's all clear here. So I'm gonna go ahead and flip you around and I'm just gonna have you hold your arms up against this over here. And I'm gonna go ahead and assess your mid-auxiliary line. So we have your mid-auxiliary here, your anterior auxiliary line, and then your posterior auxiliary line. So I'm just feeling down here to make sure that there's adequate fat and muscle stores, and feeling along your ribs to make sure that you have some nice fat coating your ribs over here and in the back. So everything seems fine up here. And then I'm gonna go ahead and move down to your iliac crest right here, also known as your love handles, making sure that it's not protruding at all, which it isn't. It's nice and full of fat, which is perfect in a healthy individual. There's no fat loss over here or sagginess of the skin or anything that could be of concern. So this all looks great over here. In someone who might be malnourished, they might not have as much fat lining their ribs up here. Their ribs would be protruding on both sides, and your iliac crest would be very prominent, which it is not, so this is nothing of concern here. And you can go ahead and put your arms back down, so it looks good over here. Okay, so next I'm going to look at your hands, and specifically right now your nails. We're going to check for any micronutrient deficiencies or any signs of malnutrition that could be indicated in your nails. So first I'm going to be checking for any spoon-shaped or concaveness of your nails and any central ridges that might be present in your nails, which I'm not seeing any. If any of these were present, this could indicate an iron deficiency. So do you notice if your nails are ever brittle or split apart very easily?
No.
Okay, so if they were brittle or dull, if they were soft or dry, and if they were thin and split apart very easily, this could be a sign of magnesium or vitamin A deficiency, or this could indicate severe malnutrition. None of those are present though, so that isn't of concern with us here. And then I also didn't notice any rigidness of your nails. That could just indicate a protein deficiency. But everything with your nails look fine. They look in perfect condition. Nothing abnormal is sticking out there. So we don't have to worry about any signs of micronutrient deficiencies or malnutrition. So next I'm going to ask if you could just make an okay sign like this with your hand. So here I'm just assessing for the interosseous muscle and between your thumb and your forefinger right here, or your pointer finger. And this looks very nice and the muscle looks good. There's no depression or looseness of the muscle right there. If that were the case, that could indicate malnutrition. But however, your muscle is in perfect condition and nothing looks concerning there. So everything with your hands and your nails looks good. So next, I'm going to be looking at your scapular region and your chest expansions. So if you can just go ahead, I'm going to hold my hands here while you exhale, but take it in a nice deep breath for me. And then go ahead and release that. Perfect, nothing abnormal there. So next I'm going to assess your back here. I'm checking your scapular region, looking for muscle definition, and making sure that nothing is protruding abnormally, which this looks fine. So then if you could just go ahead and push up against that. And again, I'm still just feeling back here, making sure that you have good muscle definition on your back, making sure that nothing is abnormally protruding, which it doesn't seem to be. In someone who might be malnourished, they would have muscle wasting, so all of these regions back here would be protruding abnormally. That is not the case for you though. So next I'm going to go ahead and check for tactile phremesis, doing a respiratory and pulmonary exam. So I'm just going to place my hands like this on a V shape on your back, and I'm going to be moving them down. While I move them down, if you could just keep repeating the phrase 99 for me. So I'm going to go ahead and get started if you want to start saying 99.
99, 99, 99, 99, 99.
Perfect. And then if you could just turn around, we're going to do the exact same thing on the front side.
99, 99, 99, 99, 99.
Perfect. So there was no abnormal signs there. I could feel your chest vibrations perfectly, and you were able to pronounce the phrase perfectly fine with me with no problem with that. So in someone that could be malnourished or someone that might have edema, they would have fluid built up around their lungs, and I might not have been able to feel the vibrations as strongly. However, that doesn't seem to be the case for you. I could feel everything perfectly fine. And just assessing you right now visually, you don't have any depression or scooping of the chest, which is normal in a healthy person. Someone who might be malnourished or having a deficiency or something could have a concave chest, but that's not the case here with you. So that's going to complete the pulmonary and respiratory assessment and assessing for the muscle and fat stores on your upper body. So before we move on to the cardiac assessment, I did just want to reiterate that if I had a stethoscope, I would be listening around your lung region and checking for any wheezing or cackling sounds, which could indicate something was stuck in your airways or in your lungs, obstructing you from properly breathing. And then I did also want to mention again that you did have proper muscle stores on your scapula. You did have proper muscle stores all down your spine that was covered well. It wasn't sticking out too much. And along the back of your ribs, those were covered very nicely as well. Nothing was abnormally protruding. So next I'm going to go ahead and move into the cardiac assessment part of the nutrition focused physical exam. So I'm just going to take your arm here and I'm going to just rest your hand on top of your head and then just relax a little. Don't feel any tension or stiffness. And then I'm just going to be assessing here for your second left inner space, your second right inner space, and your internal apex beat. So I'm just going to go ahead and place my hand over here and palpate the region, feel along here, and feel down here. So that all seems fine. Nothing abnormal came from that. You can go ahead and put your hand back down. There was no tenderness, hollowness, or stiffness, which is all good. So the next portion of this exam is the abdominal exam. So I'm going to go ahead by starting with palpations of the right upper quadrant, the right lower quadrant, the left upper quadrant, and the left lower quadrant. So at any point during this, if you feel any pain or discomfort, just let me know. So I'm going to start here by palpating the right upper quadrant. We're checking here for your gallbladder, your pancreas, and your liver. Do you have any discomfort here when I'm touching you?
No.
Okay, perfect. So next we're going to move down to the right lower quadrant. Down here we're checking for your appendix, the lower right portion of your kidney, and your right ovary down here. Do you have any discomfort when I'm touching you down here?
No.
Okay, perfect. Next, we're moving to the left upper quadrant up here. So this is where we're checking again for your spleen, your pancreas, the left lobe of your liver, and your stomach. Do you have any discomfort up here?
No.
Okay. And then lastly, we're going down into the left lower quadrant. Here we're feeling for your colon, your kidney, and again, your left ovary. Do you have any discomfort down here?
No.
Perfect. So that's concluding the abdominal exam. I did not feel any distension. There was no swelling, which would be ascites. There was none of the fluid buildup there. The color of your skin looks good. There's no yellowing of your skin or dark spots anywhere that could be abnormal. So everything with your abdomen looks good and there was no discomfort, so that's also good. So I'm just gonna have you scoot back a little bit and we're gonna assess your quadricep muscles. So I'm gonna take your leg and prop it up here. So as we can see, your quadriceps are up here. Here we're just assessing for muscle and fat, and as you can see, you have a good separation between fat and muscle up here, which means that you are properly nourished. And someone who might be malnourished, there wouldn't be as much muscle or fat on the bottom. So everything looks good here. When I'm palpating it, it's all bouncing back. It's not tenting or anything like that, which could mean that there would be edema present. So that's good. And again, your skin has a good color. There's nothing concerning about the color of your skin down here. No looseness of the skin either, which is good. So next, I'm going to move down into your patella region. So I'm just going to cup my hands like this. I'm feeling above your kneecap up here to make sure that there's no excess boniness or prominent protrusion of your bones up here. I'm cupping on the bottom of your kneecap down here, again feeling your bone and your muscle. And then I'm moving around up here on the top and just feeling up here. So all of this on your kneecap looks good. You don't have excess protrusion of your bones. And someone who would be malnourished, they might again not have as much muscle or fat stores. So your kneecap would be abnormally protruding, but all of this looks good up here. so there is nothing of concern there. So the next portion of the exam is assessing the gastrocnemius muscle or the calf muscle down here. So really I'm just checking to make sure that the calves are symmetric, which they are. I'm also palpating the regions here and looking to see if there's any depressions after I press on the calf region, but the skin is bouncing back nice, so that means that there's no swelling or edema present, and there's adequate muscle stores here, so there's no malnutrition or, again, muscle wasting. And someone who would be malnourished, we wouldn't see all of the muscle back here, and it would be very bony. So if you can go ahead and turn around. To conclude the nutrition-focused physical exam, we're going to be, again, like I mentioned earlier, ending at your ankles and your feet. So here I'm just assessing the size of your ankles, making sure that they look symmetric, which they do. There's no swelling or fluid buildup, which in the ankle and feet region, the lower extremities of the body, that's the most typical place for edema to be present. Again, I'm just palpating the tops of your feet down here, making sure that the skin's bouncing back nice and adequately, which it is. And when I'm pinching the skin up here, checking for skin turgor, there's no tenting. It immediately falls right back down into place, which is normal in a healthy person. So nothing about your lower extremities here would indicate any malnutrition or edema. So this all looks perfectly normal. This concludes our nutrition-focused physical exam. Nothing alarming really came from this. Again, there was no signs of malnourishment. You didn't have any muscle loss or fat wasting. When I was looking into your eyes again, there was no signs of jaundice, nothing abnormal inside of your mouth that could indicate anything wrong there. We did start from the head and go all the way down, so your skin turgor was perfect. There was no tenting of your skin. When I pinched it, it fell right back down. There was no signs of edema. Again, when I was palpating your skin, it bounced right back up to me like normal. Nothing abnormal of your skin came about, and your nails looked perfectly fine. So that's, again, concluding the nutrition-focused physical exam. There's nothing concerning here that I should mention to your doctor, so I will pass the results along to your doctor, and hopefully you'll be discharged soon.
Thank you.